So the reason why we are talking about this today is that we know that at some stage all of us, all of you are going to be team members. We already have been. I think I was thinking about this yesterday. Maybe it started with us when we were posted as interns in certain units. So in the medicine unit where I was posted as an intern, me along with all the hierarchy above me, the JRs, the SRs, the PG students, the consultants, we were all one team which were providing healthcare services to the patients who came to us. Likewise, there are various types of teams. There are liver transplant teams, there's cardiac cath lab team, etc., etc. We'll talk about this more, but everyone needs to know about this because we, like I said, we've all been parts of a team. What I'm going to talk about today is actually very basic. It's really common sense, which all of you really know about. It's just that to put it in a proper protocolized method means that you don't leave out anything. So we are talking about what ideally should be the ideal case scenario, and maybe when you all, if you go to corporate hospitals or you go abroad, you'll really be utilizing these points. So as a very old Dilip Kumar song goes, ke saathi haath badhana, which is an example of teamwork. We all know it's a classic example of teamwork. But they had said ek akela thak jayega. In medicine we know ki ek akela to kar hi nahi payega. It has to be a team. What the anesthetist can do, the surgeon can't do. What the surgeon can do, the cardiologist can't do. So it has to be a team of people who deliver healthcare. There are different types of teams, but all effective or efficient teams will have certain characteristics. However, what values I bring to the team and what assumptions I have towards patients, towards my colleagues, or towards healthcare are definitely going to affect my interaction with the other team players. The other three slightly less important issues which are there are what are the roles of team members, whether these roles are fluid or they are set in stone, what are the psychological factors which affect team interactions, and what is the impact of change on teams, because change is definitely going to occur from time to time. So there are various types of communication techniques which are utilized within teams. Then there are conflicts, but conflicts are bound to arise. If there is no conflict, then probably the team is not delivering at all. However, they should be resolved in a manner which is again, takes you forward and not backward. Mutual support, of course, is very important, and we have to change and observe behaviors, ours also and our teammates also. So the few topics, इतना लंबा लेक्चर नहीं है, डरना बिल्कुल मत, बहुत छोटे छोटे पॉइंट्स है. So what are the teams, various types of teams, how do they form and develop, and how do they improve patient care? What are the components of an effective team? How is leadership defined? How is communication done? How are conflicts resolved? What is feedback? What are the barriers to good teamwork, and what are the carry home messages is how we'll divide this talk today. As we all know, this is just a definition. It's all of us know by now what a team would mean. It would mean a group of 2 or more people. However, in this context, it means people who interact with each other. They have a definite common goal or mission, which is to deliver healthcare in a protocolized manner. They have usually been assigned specific tasks, and all of them will have some skills which are complementary to each other's skills. A very important thing is that because this is always an ever-evolving and dynamic sort of thing, so they will have the team will have limited lifespan of membership. It is understood that people will come in and people will go out. That sort of turnover is going to be natural. That will subtract something from the team, it will bring something more to the team. But that is natural, that's the logarithmic progression. That's a logical progression, sorry. So the types of teams that we find in healthcare, there are multi-professional teams. There are co-located teams, as in, for example, transplant teams, where the harvest is done in one place and the transplant actually is in another city or another hospital in the same city. So those are the sort of examples of co-located teams. Then there are some teams which have been really long-standing and some which are transitory. and go off after some time, which were only formed for that particular case, and then they sort of go off in different directions. American Hospitals Association has given a model which is a long enduring model of how teams should actually behave, how they should form, how leaders should manage, and how communication within teams should occur. So because this is a really good and enduring model, so this is the one this is a basic model which we choose to always take as an example. So this is the TeamSTEPPS model, which has leadership, situation monitoring, mutual support, and communication as its pillars. So there are various types of teams. At the apex of everything, of course, is the patient. At the bottom always is administration. In between, there are various types of teams. And then there are some contingency teams which may be brought in because something went adverse or was unforeseen or something. So a contingency team may also have to come in. For example, in the cardiac cath lab, the cardiothoracic team, if that has to come in because a VSD occurred on the table. So for a group to become a team, it is important that we all respect each other's skills and we work together towards the common goal. This is really interesting. Bruce Tuckman was actually an American psychologist who talked about how groups form into effective teams, and he talked about this in 1965, and the model is still in use. So he said that there are 4 stages to a team forming, developing, and working together. So when they come together, of course, that's beginning. When they keep working together, then there is progress, and finally there is success, which is what we want. In healthcare, we need nothing less than success. The targets have to be delivered. So in the forming stage, there's first a forming stage when everyone is dependent on the leader. Everyone is chaos, they don't know what is happening, and the members may not be really in sync with each other on what is the common goal. So the leader has to be really prepared to be able to answer to all queries. So this is the forming stage. And obviously it tests the tolerance of the system as well as the leader. In the next stage, storming, the clarity of purpose increases, however uncertainties persist. Various team members may have a one-upmanship sort of division that I want to take this position and I want to take that position. Cliques and factions may form, which is not always good, and there may be some power struggles. But keeping all these in mind, everybody is human, there are going to be power struggles, there are going to be all these problems, but the team needs to be focused on the goals, and some people may need to compromise in order for the entire team to reach progress and success. And the leader has to act as friend, philosopher, guide. The third stage, which is norming, the roles and responsibilities of the team are by now quite clear, quite accepted, and there is agreement and consensus on how we go forward, how we move forward. Big decisions are still formed by group agreement, but smaller decisions can be also taken by individuals or smaller parts of the team. At this time, the team is at its best because they have strong commitment and unity, and leadership is single, but others are also acting as leaders because everybody at this stage is sort of a leader, and social bonding going on, picnics together, having dinners together, and other social bonding exercises bring the teammates closer. And then comes the stage of performing. हमने form, norm, storm सब कर लिया, लेकिन actual test of the pudding lies in the eating, so performing is important. So the team is aware that now we need to deliver on the targets. In fact, if the team has been formed correctly and they are working cohesively, they may even surpass the targets. Disagreements will occur, of course, but they can be solved amicably, and the team does not need instruction or supervision at all times. The leader merely needs to delegate and oversee what is happening. When I was actually thinking about all these, I thought that the best example that came to my mind was of SGPGI, which really had all these stages and finally is at the performing stage. And then, but Tuckman also added in 1975 a 5th stage, which was of adjourning and deforming and mourning, which also we can imagine that SGPGI has to an extent now, because the group starts breaking up also, because members move on to newer things. They move on to greener pastures. and to better jobs, to better opportunities. These could be anybody. These could be doctors, they could be nursing technicians, they could be people in other ancillary services who get better jobs elsewhere. So they move on. From an organizational perspective or the perspective of the team which is performing, this is important because the team may have lacunae. Because, for example, if an interventional radiologist who was in a specific task leaves and nobody else has really grown to take that position, then that particular team is going to miss that member and that skill. So there will be problem in patient care till that time that position is filled. And of course, there will be emotional lacunae for the people who are left behind. So this is how the institution needs to take care of the people who are left behind. So when you have a team, of course, it divides the task and multiplies the success, and then people move towards the task which has been assigned to them. Teams, of course, improve patient care. We always talk about patient care at the level of organization, at the patient level of outcomes and safety, the team as a whole, and of course for individual team members also, it's a feel-good thing when you are delivering all the targets which you were supposed to deliver. So, like we said, that this is how teams are formed, but what are the components which an effective team will always have, which therefore translate into healthcare and patient safety? There is a common purpose, the goals are measurable, there is mutual understanding, there is respect, there is cohesion in terms of the goals, there is also flexibility in terms of roles. Everyone self-monitors the situation and themselves. The leadership is motivational, there is good communication. Whenever there are conflicts, they are resolved nicely, and then there is feedback. So the leader's role is, of course, extremely important because he has to delegate tasks and give out roles, assigned roles. They have to also get into briefs or brainstorming sessions to see as to what is the next step forward we must take cohesively as a team. At the same time, there must be enough democracy within the team so that the team members are able to speak freely, give feedback and interact. And the hierarchy must not be so much set in stone that people cannot criticize or give feedback. At the same time, improvement such as CMEs, workshops, etc. for individual people to gain better skills must be on, so that while the teamwork does not suffer, the individuals also progress and grow, and the leader must be able to inspire the followers and maintain a positive group culture. A good leader is going to constantly monitor the situation, set priorities, take decisions which are proactive depending on the situation, be on his feet, think with his brain, utilize the resources, again very important in a resource-strapped country like ours, so that within the limited resources, the performance is the best. And of course, most importantly, also have, see to it that conflicts are resolved peacefully and positively, and the workload is equally divided. He should also not shy away from calling for help whenever it is needed. So, like Michael Jordan said, that good leaders have to earn their leadership all the time. They have to be on their feet. What are the various techniques which within teams are used? Like I said earlier, these are all common sense. However, if we know the protocols, then we make sure that we do not miss out on any steps when these teams are performing together. Whenever we are parts of such teams, which we all are, knowingly or unknowingly, we do not always in healthcare systems, we don't always maybe define our roles, but forever we are in various teams which go on to provide healthcare. So there are various techniques which have been developed to promote communication. SBAR, which stands for Situation, Background, Assessment and Recommendation. This is an example of SBAR where the situation was that they are talking about a patient who was febrile and shivering. The background was that he has had UTI earlier, he has history of cystitis, he has an indwelling catheter, and he has right now a high temperature, and he is taking paracetamol, but he is going from bad to worse and getting confused also. Assessment, he seems to have a severe UTI, and the recommendation of course is that a urine sample should be ordered. Meanwhile, start good amount of fluids, an empirical antibiotic while reporting for the culture report. So this is an example of SBAR. This is how one person of the team would communicate to the other and tell about the situation and the patient. Then there is call out. Call out is a way in which a critical information during an event is told to all the team members. For example, during an incoming trauma, everybody, the leader says to the other person, what is the status of the airway, what is the status of the breath sounds and the blood pressure. And the other people also, everyone listens so that everyone is ready to react with whatever roles they have been assigned within the team. For example, what the cardiology resident has to do and what the anesthesia resident has to do. It's all clear to them what is the next step for them. They all know. So call out informs all team members simultaneously so they are all ready to anticipate their own next steps. Then there is something called a closed loop communication strategy. When you give an order or you tell about a situation and then you get a check back to see that the correct information has been heard and is sent back to you. So the sender verifies basically that the correct message was received. So it's a closed loop communication between the sender and the receiver. For example, one member of the team saying during the surgery, for example, if bleeding is occurring or if the BP is falling, that the BP is falling and it has come down from 90/60 to 80/48, and the other team member verifies, and then the original sender says, yes, you have got the correct message, so that we can take a corrective measure right away. So this is an effective tool for all members of the team so that there is no confusion at any step. Then handoff or handover, which means that when we give over the patient care to another member of the team, then the continuity of the care does not suffer. So in the handoff, we basically tell all about the patient, and the receiver of the handoff or the handover, this is the opportunity that they ask all the questions and they clarify and confirm if they are not sure that the antibiotic shot was given or not, the painkiller, the last dose was given or not, so that neither there is underdosing nor there is overdosing. Of course, despite all good methods of communication within teams, there are always going to be disagreements and conflicts. So there are certain ways in which conflicts should be resolved within healthcare teams in a protocolized manner. So the first is the 2 challenge rule, which is come from aviation industry, where 2 pilots are always there, and if one pilot sees that the other one is not doing something wrong, then he is supposed to call out to him and to all the crew members. Likewise here, anybody who sees that something is occurring which is breaching patient safety according to him, then they should voice their concern, no matter what sort of role they have in the patient care team. So they should voice their concern at least 2 times and give an assertive statement. If the first time also this is ignored, then they again say the same thing. If it still doesn't get heard, then you go to the next person in the chain of command. So this is the 2 challenge rule by which you try to bring in self-checks within a team. We know that we were always taught as kids never to use cuss words. However, within teams, if there are problems, if you're concerned, if you're uncomfortable, if there is a patient safety issue, always use cuss words. Be free to use cuss words, but of course in a parliamentary manner. Likewise, if there is a conflict, we should do the desk. We should describe the specific situation, express our concerns. We should have maybe some other alternative in mind which can be used. And however, if that alternative is not used, then what are the consequences should also be said. So we can desk it like this. A timely discussion in a private location. Avoid blaming. The focus should be on what is right, not who is right. And the receiver should always remember that critique is not criticism. Critique should be valuable. So coming to critique, and a very important part of critique is feedback. We all here know what is feedback. However, to be effective, feedback should be given well on time. It should be contextual as to, pertaining to the particular case that was occurring and what patient safety breach or protocol breach was occurring. It should be done with decorum in a respectful manner. It should be directed towards improvement so that we prevent the same problem occurring in the future, and one should be considerate towards the person to who or about who the feedback is being given. So a lot of problems, of course, we know would not be there if we talked to each other instead of talk about each other. That is the importance of good communication. Despite all good communication and conflict resolution, there will always be still barriers to teamwork, which occur naturally because of changing roles. People grow on to become more senior. People may acquire new skills, and therefore they want that now their role should change commensurate with the skill that they have acquired. In medicine, the hierarchies sometimes are so strong that you find it difficult to reach the hierarchy to be able to bring up a point which you need to bring up. The individualistic nature in which we all practice medicine, because there may not be set guidelines, so everyone may be going with different sort of guidelines or different treatment strategies, that will also be barrier to a good teamwork being delivered. And of course, like I said, unstable nature of teams, because people keep coming in and going out from teams, and sometimes we may lose valuable members of the team to greener pastures, to other institutes, to institute politics, etc., etc. This it's all human, so all these things happen. So still, to get over barriers, we have a few things. For example, during the brief, when the teams meet, we all need to know who all are on our team, who all are on our side, who are we working with, do they all know their roles and responsibilities, what is our patient care plan, and is the workload shared equally, what resources we have available to us, and who are the staff available to us. And likewise, at the time of the patient care event coming to an end, for example, an operation or surgery coming to an end, or the patients getting discharged, these are the things that we can talk about. That was everything clear, communication was done well, conflicts were resolved or not, and most importantly, whether any errors were made, were any errors avoided well in time, what went well or what didn't go well. So a SWOT analysis of what happened and how we can improve in future. A very important point, whether I am safe or not, whether I am safe for myself, for my colleagues and other team members, and for the patients for who I am delivering patient care, whether I am safe or not. So whether I am healthy or not, and under any medication which is going to affect performance, any stress again which is going to affect performance, any alcohol and drug abuse, any fatigue which is occurring. We are all humans, fatigue is part of life, and any eating or bowel problems which are likely to cause any problems. I feel कि eating and elimination उन्होंने SAFE का नाम acronym को complete करने के लिए दिया. So, and of course any team needs to also have its performance finally assessed, which is an ongoing thing, of course, when you're doing it yourself. So it's an ongoing, all hospitals, all departments have their own audit systems. At the same time, we also know what we did right, what we did wrong. So that's all ongoing. And then it can be audited by external observers also. The carry home messages. Teamwork doesn't just happen. It's like a marriage. You have to work on it every single day, every single minute. There are some well-documented teamwork principles which we just discussed, which everyone should know and everyone should utilize when they are communicating within teams, so that patient safety is not hindered and healthcare is effectively delivered. And a lot of such techniques will lead to improvement in communication within teams. So sometimes most ordinary things can be made extraordinary when people are working together. As we all know that there are some people we enjoy working with and some people we are all pareshan working with. And however, tough times do not last, while if conflicts are resolved well and teams effectively communicate well, then tough teams do outlast everything else. Thank you.